Welcome to my world. Another day, another time, another period for knowledge acquisition. Knowledge is power, health is wealth. Today's topic is diagnosis of pancreatitis and pancreatic cancer. The two ailments are more or less talking about sugar control and probably lipids. The energy of the body, the source of energy of the body is glucose, and the pancreas plays the major role in the regulation of this energy given substance. You can then understand that by way of saying pancreatitis, you are more or less talking of an inflammation of the pancreas, and then when you talk of pancreatic cancer, you are talking of the malfunctioning of the pancreas. So the importance to diabetes is not so exposed, but regardless, we are going to more or less expose some of these areas to you. The dual function of the pancreas is what makes it control both the enzymes that affects glucose and also the hormones, insulin, that also affect glucose. So when you talk about the pancreas, you are talking of a very important organ in the body that has to do with energy production and energy control. So let us stay hooked to understand more about how do we diagnose the problem that has to do with our energy control. The objective of this video is to create the necessary awareness of pancreatitis and pancreatic cancer as two distinct ailments and how to prevent them and also diagnose them. Introduction. Pancreas comprises both endocrine and exocrine cells. You may want to know what an exocrine cell is. It is a cell that produce and secrete to the epithelial cells, like the sweat that secretes to the skin that makes the skin wet, or the sebaceous secretion that makes it oily. The majority of pancreatic cells are endocrine cells, which make up the exocrine gland and ducts. These cells are responsible for secreting a range of enzymes, including amylase, for carbohydrate digestion, proteases such as trypsin, chymotrypsin, elastases, and carboxypeptidases for amino acid digestion, and lipase for the breakdown of fatty acid. In contrast, the endocrine, these are different. They produce into the blood, not onto the epithelial cells. In contrast, the endocrine cells comprise a relatively small portion of the organs, secrete hormones such as insulin and glucagon, which regulate blood glucose level by releasing them directly into the bloodstream. So that exactly tells you the difference between the two cells. But the majority of the pancreas cells are made up of the exocrine cells. Pancreatitis. It is the beginning acute and inflammatory condition triggered by factors such as alcohol consumption, gallstones, type 2 diabetes, smoking onset, and hypertriglyceride. You are really talking of obesity as well. The incidence of acute pancreatitis varies widely, with estimates ranging from 10 to 40 cases per 100,000 population, with a tendency towards higher rates in regions with high alcohol consumption. So it's that implication that if you consume too much alcohol, it's not only going to affect the liver, it's going to affect the pancreas as well. So chronic pancreatitis is characterized by the gradual and irreversible degeneration of the pancreas caused by persistent inflammation, which that alcohol injury causes, which destroy both the exocrine cells and endocrine cells. Pancreatic cancer. It is a graduation from acute to chronic and now to pancreatic cancer. Both pancreatitis and pancreatic cancer share similar symptoms such as abdominal pain and weight loss, etc. But pancreatic cancer often has jaundice. That's one of the ways to know that it has graduated. The malignancy arises from either exocrine or endocrine cells. The most prevalent form of pancreatic cancer originates from the exocrine cells, specifically known as pancreatic ductal adenocarcinoma, which accounts for 90% of the total pancreatic cancer, with a 5-year overall survival rate of less than 10%. That is very instructive. It means once you are diagnosed, it's like you are having just 5 years to live or less, and that is rate of less than 10% people. According to GlobalCan 2020 report, it ranks as the 12th most frequent cancer incidents, 4.96 million cases among the top 7 leading causes of cancer-related deaths. It is number 4 in the when you are talking of cancer mortality. The rating is the pancreatic cancer is number 4. Prevention. Let's talk about the prevention. Many cancers mortality rate has been reduced. For example, the cervical cancer and breast cancer, which were highly devastating before, but it has now by early detection of the malignancy with specific tumor marker tests or palpation been reduced to something almost like it's been gradually eradicated. But pancreatic cancer is itself insidious. It will continue to grow little by little, and no specific marker tests except the carbohydrate antigen 91.9 and CEA that are also produced by other tumors, and at times not produced by pancreatic cancer cells itself. But however, avoiding the risk factor is a safe way of preventing pancreatic cancer. Now let's look at the risk factor. Pancreatitis risk factors, just hereditary or familiar disposition. You can start from there that is hereditary. This disease subtype is caused by genetic mutation, specifically in the trypsinogen genes, and it can degenerate to pancreatic cancer. Pancreatic cancer risk factors. There is an established risk phenotype in individuals with blood group A. So if you are blood group A, you need to watch it. Several studies have revealed that individuals with blood group A have a significant increased risk of developing pancreatic cancer compared to other ABO blood group. Age is another factor. New cases and deaths occur in individuals aged 55 years and above. They've not experienced any problem like that before. It happens at that period, with a combined peak incidence rate of 89.6% and a combined peak mortality rate. And when it happens, it means it's sure to die. 93.3% as revealed in 2022. The risk factors are inexhaustible. Additional risk factors for pancreatic cancer, if a person is diabetic, patients have a higher risk of developing pancreatic cancer. This is possibly due to chronic hyperinsulinemia, that is high level of insulin in the blood, which can lead to the growth and proliferation of cancer cells. Therefore, individuals with a certain blood type group O and diabetes may have an even greater risk of developing pancreatic cancer. These are findings by workers. Obesity and a high-fat diet are inducers of tissue inflammation in development of pancreatic cancer. Smoking. The overall burden of pancreatic cancer could be reduced by 25% if smoking was eliminated. Every alcohol consumption is also associated with higher risk of pancreatic cancer. The microbiota, the existence of microbes within the pancreas, exacerbates pancreatic cancer development, though its promotion of innate and adaptive immune suppression. The diagnosis, we talk of pancreas function test. The serum concentration of amylase and lipids rise within hours of the pancreatic injury. Amylase is that which is used to act on carbohydrates to produce that glucose that, if not well controlled by the insulin and what have you, could give rise to diabetes. The serum lipase is now the preferred test due to its improved sensitivity. It's more sensitive, particularly in alcohol-induced pancreatitis. Tumor markers, the carbohydrate antigen, you look for the normal value of 37. Histological examination of the biopsy is also another one. After all these tests have been done, you can also use ultrasound, MRI, plus the clinical presentation and jaundice in concluding accurately. Ordinarily, the carbohydrate antigen 19.9 would have been the very useful. One wouldn't have need to do any other test, but by the time you find some patients now even positive, but having the pancreatic cancer, but they are not really showing the CA at all. From all we have seen, we must have learned a lot about the pancreas as being very important, and also why it has now assumed a very serious concern, even being the fourth most deadly cancer known now. So let us look at how we can help ourselves to really control the diabetes or avoid all the risk factors so that we don't become a victim of this pancreatic cancer or pancreatitis.